Chris Simon could really play, but he was best known as a tough guy. His fighting skills made him a fan favorite here in Colorado, a big part of the Avalanche's first run to the Stanley Cup in 1996. Simon died by suicide last year at the age of 52. Now, a new report out this week says Simon had severe stage 3 CTE when he died. His family is releasing those findings to try to help raise awareness for the long-term effects of repetitive head impacts. We want to talk more about that with our 9 News medical expert, Dr. Payal Kohli. And we're starting to see more and more of these results from athletes that played 20, 30, even 40 years ago, football, soccer, hockey, sports like that. CTE is becoming, I think, more prevalent than we knew.
It's definitely being diagnosed more than we knew. In fact, it's been around since the 1920s when we first saw sort of behavioral changes happening in boxers. In fact, it was called the punch-drunk syndrome. They got punched in the head and they started behaving a little bit differently. But, you know, there was a very interesting study published in JAMA, the Journal of the American Medical Association. If you look at athletes under the age of 30 who died, who had repetitive head trauma, up to 40% or more of them actually had CTE at one of those stages. Now, it's staged like cancer, stage 1 being mild, stage 4 being severe, but it's really a problem with repetitive trauma to the brain that causes bruising and injury to the brain, and it can actually shrink your brain. So parts of the brain involved in emotion can actually be smaller in people with CTE.
The leagues don't like to talk about it, but he's not the first fighter from the NHL to have been diagnosed post-mortem with CTE, and that's the problem with diagnosing it. At this point, we still diagnose it only after death.
A huge problem. We have post-mortem diagnosis only. You have to cut up the brain and look at it under a microscope to know that somebody has CTE. Really where we need to get to is a pre-mortem diagnosis, because we know that people are high risk. We know that it's much more common than we're picking up. Even though we don't have treatments or therapies yet, certainly prevention can be more of a focus. And so I'm hoping that the future of CTE research doesn't just look at wearing helmets and preventing the trauma, but actually following blood tests or biomarkers that might be able to tell you you're starting to accumulate these proteins, or better MRI techniques to image them.
Well, and we think about all the kids that sign up for all these sports and long-term impact of concussions and things like that. When you talk about shrinking the brain, though, and emotion, so family members might actually notice.
Very much.
But
yeah.
What do you do?
Well, so we know that there's a genetic component to CTE, so certainly it puts up your radar. If you think about somebody having behavioral changes, an athlete, a young teenage adolescent athlete acting out, it's not just acting out, because it actually shrinks the parts of your brain that help with impulse control. It shrinks the parts of your brain, the hippocampus, that helps with memory, and it shrinks the part of your brain that helps with fear, the amygdala. So they're scarring and shrinking of these areas, which means you're much more likely to take your life by suicide, because all of those put together make you more paranoid, less likely to control your impulse, and more aggressive.
I want to ask you that about, because you talk about kids and what happens here. At this point, if you were able to have a pre-mortem diagnosis of CTE, what would your prescription be? Stop doing what you're doing, but is there no recourse? There's no curing. There's only maybe stopping of the clock?
So yes, stop doing what you're doing, no more head traumas, but also there are a lot of clinical trials looking at whether anti-inflammatory medications that can cause prevention of degeneration, Parkinson's types medications, other types of medications for degenerative diseases where the brain gets trauma and accumulation of these tau proteins, they may help clear some of that damage and clear some of those proteins. So I think for parents, and for anyone, in fact, who has people in their family that play sports where there's contact, keeping an eye out for this, doing regular neurocognitive testing. So you're screening people for changes in their behavior. You're not just waiting for something bad to happen and then saying, oh, they might have had CTE.
Research into this is so important because it's connected to dementia, it's connected to ALS, it's connected to so many other things.
Long-term problems in life.
Sad to hear that about Chris Simon. His life ended too soon, but we will continue to study CTE and learn more as we go. Dr. Payal Kohli, thank you.